Okay, so what we're going to do now is we're going to tape his knee for what we call hyperextension. So the mechanism is a push into the front of the knee, pushes the knee back, causes a lot of pain in the posterior side. So we want to put his knee in a little bit of flexion and limit how much extension, hyperextension that he actually has. So the first step here is to get him a little bit kind of into flexion. So one option is to put a roll of tape underneath the heel, and that's going to give him a little bit of a bend here in the knee. You can do a book, or you can do a whole host of things. This tape works a lot better if you can actually secure it to the skin. So if you can shave them, that's better. And so, but here, for this situation where he's not clean and shaven. There's a couple pieces of tape that go right here in the popliteal space. So what we're going to do is we're going to put a couple heel and lace pads right back here. That's really going to help protect that particular spot from irritation and chafage and other problems. Another thing that I'm going to do is I'm going to do some pre-wrap just to help protect the middle areas of the wrapping that we're going to do. So I'm starting on the thigh, starting in the calf, coming up around the thigh. Getting a good spacing from the middle down about 5 to 6 inches, and at the top about 5 to 6 inches, because we want enough space in between here. If we get too short, it really doesn't help us out. So we want to elongate this as much as we possibly can. So now that the pre-wrap is down, I'm going to do a couple of anchors. So I'm going to do one anchor, 2 anchors. You can see I didn't quite have him go all the way around because I don't want to tighten up the calf too much. So I'm going to close these off, but I'm going to have him tighten up his calf nice and tight. Secure those down. Again, these are just anchors. I don't really want them too tight. I just want them to hold on up here. I'm going to do one, same thing, up the thigh. Okay, have him tighten up his thigh. Tighten up his thigh. Okay. Now once that's done, make sure that these are nice and secure onto the skin, because I'm going to kind of attach these with pieces of tape, and I don't want it to pull down too much. Okay? So now what I'm going to do is I'm going to make X's from one anchor to the other ankle, crossing right where that heel and lace pad is. So I'm going to bring this piece here, I'm going to pull that. I can come all the way around if I want to, kind of leave it short, but I want to make sure that that lays kind of nice and flat. From anchor to anchor. Okay? So now I've created a nice little base here for the next pieces, and these next pieces are what really provides the strength of this tape. So the way that I do this is I attach here. Now I'm going to twist. Okay? And what that twisting does is that twisting adds a lot of strength. If you put the twist in there, you can hardly tear this tape because of wrapping that around. Do another one on the other side. Tighten these up. Pulling fairly secure, so I want these to be nice and tight. Okay. Probably going to repeat that 1, 2, 3 times. The larger the athlete, the more of these I want. Okay. So for him, I'm just going to do 3, or just going to do 2 of them. I'm going to take a final piece, go over top of those. So what that's going to do is that's going to hold those twisted pieces in place. They're not going to slide around, they're not going to rub as much. It's going to provide a nice amount of strength on here. Okay? Now, once that's done, I got to tighten those pieces down just like I did before, not securing them all the way around. Have him tighten up his thigh again. Same down here at the calf. Tighten up his calf. Get those down. Okay. Now what I'm going to do is I'm going to test it. I'm going to see, okay, now what I want you to do is try to hyperextend your knee. And you can see that those get nice, snug, and tight. If they're not tight and he doesn't prevent him from hyperextension, you haven't done it right. And you have to start all over, or you have to add more to it to make sure that that's secure. So you want to make sure that these are, you know, good and snug and secure. And then the final thing we do once we know that we're done and we're good, we're going to take plastic wrap, this all the way around. Now it's all covered. It's not going to move around. It's not going to slide around. You can actually go out and play with this. Alright. So now what we're going to do is we're going to show on this leg and spin around. Just to stay right here. You can actually do this wrap for medial collateral ligament sprain, lateral collateral ligament sprain. The only difference is our anchors are going to be the same, but when we make our X's for a lateral collateral ligament, our X's are going to go on the lateral side, right over the lateral collateral ligament. Probably a little high here, so I would bring that down just a little bit. Okay, do my same spirals, everything the same. If it's on the medial side, I'm just going to do that exact same thing, but have my X's on the medial collateral side. So you can do posterior, lateral, and medial, all with this particular tape job, just by changing up where you actually put the pieces.